All right. I think it is time to start. So welcome, everyone. Thank you for joining us. I'm Patricia Rosenmeyer, Faculty Director of the Carolina Center for Jewish Studies, and it's my pleasure to welcome you to our Emerging Scholars Talk with our very own Morgan Morales. And as a special guest, we also have with us this year's Cohen Distinguished Visiting Professor, Brett Ashley Kaplan from the University of Illinois at Urbana-Champaign. And Brett is a scholar of the Holocaust and also a writer of fiction. So if you're interested in reading about whales who speak Yiddish, we can recommend a book for you at the end of this session. So we started the Emerging Scholars series in the fall of 2020 as a way to introduce Carolina graduate students and their research to the greater community. These online talks are usually based on a student's dissertation research. And because our students and faculty work in such a wide range of subfields of Jewish studies, I think this series really exemplifies the breadth of scholarship that's taking place on this campus. And if you missed any past Emerging Scholars talks, you can view them on the center's YouTube channel. I want to remind you that these events are made possible through generous gifts to the center. And if you'd like to learn more about it and how you can contribute and help us meet our mission, please visit us at jewishstudies.unc.edu. So tonight's speaker, Morgan Morales, completed her undergraduate degree at the University of California, Irvine with a degree in history. And she then completed a dual master's in history and Jewish studies at Indiana University in Bloomington, where her research focused on Jewish history, gender, and the Holocaust. Her current work focuses on the reproductive health decisions made by Jewish women during the Holocaust in order to survive. In addition to her current dissertation completion fellowship from the Carolina Center for Jewish Studies, her work's also been supported by the European Holocaust Research Infrastructure and the Association for Slavic, East European, and Eurasian Studies, and a few other organizations. Tonight's talk is titled "A Matter of Life and Death: Jewish Women Who Chose Abortion During the Holocaust." And after the talk, we'll have a brief question and answer period. So I would ask you to put your questions into the chat section at the bottom of the screen. And then Brett and I will get to present them to Morgan for some answers. So I'm going to hand it over to Morgan. It's all yours. And I know you have a screen to look at.
I do. Thank you so much for the introduction, and thank you for this opportunity. I would really like to begin by thanking the Carolina Center for Jewish Studies for their continued support throughout my years here at UNC. Without it, the research and maybe even more importantly, the time to do this can be very hard to come by. So I'm very appreciative of that. And thank you all for coming out. This is a very, very nice turnout. I am related to several of you, so thank you for coming and finally learning what I do. All right, okay, so Rachel Frommer, later known as Rosalie Wattenberg, was born in 1919 in Warsaw. She was one of 5 children with 3 brothers and 1 sister. She described her family as conservative Orthodox. They were a middle-class family, and had a live-in maid. She and her siblings attended university. 1 brother was a doctor, and Rachel herself was training as a nurse at the Chista Hospital prior to the outbreak of war. Rachel married Avram Svikl, and they lived with her family in the home where she had been born. Fortunately for them, relatively speaking, their home was within the ghetto walls, and they were able to remain there even during the occupation. Rachel told her interviewer with USC's Show a Visual History archive of the intense hunger and rampant illnesses that plagued the Warsaw Ghetto. She and her family, she admits, were relatively fortunate compared to others imprisoned in the ghetto. Her brother's job afforded them extra food, and later her husband was able to do the same from his job cleaning the university. The extra food went to already existing children living in the house. As she said, disease was everywhere, and she herself was stricken with typhus. Very often, German authorities would demand the entire house to be closed and fumigated, and everyone inside quarantined. Not allowed to leave, this meant that they could not get food to feed residents who were already on meager rations of 184 calories per day. Of course, this did not mean that each resident was getting 184 calories. Frequently, they were consuming far less. Rachel and Avram survived the Great Deportation that lasted between July 22nd and September 21st of 1942, and resulted with 200,000 Jews being sent to Treblinka and then murdered. In early 1943, Rachel realized that she was pregnant. She sought care from a doctor who had treated her entire family throughout their lives. He then recommended her to a gynecologist who performed the abortion while her husband waited in the hallway. She claimed decades later, quote, "And I knew if I will have a child, I won't survive. So I had an abortion," end quote. Rachel's story illustrates many of the aspects of having an abortion during the Holocaust, including an awareness from women of what healthcare was available to them at that time. My argument is that this was a method of survival that was dependent on earlier knowledge of what reproductive healthcare choices were available to them. Historian Zoe Waxman argues that because Nazi Germany was a gendered society, that persecution was also gendered. I'm extending that to argue that survival could be gendered as well, and I'm happy to delve more into that in the Q&A. In this case, this was a method of survival available to women because of something that they experienced as women, pregnancy. I want to make 2 quick notes about terminology. I use the word abortion and the term reproductive healthcare sometimes interchangeably, and that is because abortion is a form of healthcare. I also refrain from describing abortion as resistance. There are times in Holocaust scholarship where the concept of resistance is overused, and I would not want to dilute the meaning of the word. Resistance needs a target, something against which to resist. And from what I have found so far, the women choosing to end their pregnancies were making more inward decisions. They were concerned with saving themselves for the sake of saving themselves and perhaps a partner, and not inflicting or taking action against a specific group, in this case, the Germans. Instead, I propose we think of abortion with the term Amidah in mind. Amidah is the standing prayer in Judaism and has been used to mean to stand up for oneself. So, a bit of a roadmap before we continue and really delve into this, because so often our contemporary discussions about abortion are dominated by Christian rhetoric that has only developed within the past 50 or so years. I will give a brief overview of how Judaism approaches the topic. Then I will give a little background on abortion and reproductive health care in interwar Poland before finally moving into a discussion of perinatal health concerns and abortion during the Holocaust. So let's start by going back about 900 years. According to the Talmud, until the 40th day after conception, the fetus is considered merely fluid and not yet a living being. The medieval rabbi Rashi argued that only when the head of a child has emerged from the womb has it attained personhood. The Mishnah states that if a woman is having trouble giving birth, her life must come before that of the fetus, and it is permissible to remove the child if the larger part of it has not already emerged. While this debate has by no means been settled within Judaism, there is nearly 1,000 years of rabbinical responsa that not only permits abortion, but considers it a requirement to save a life, that of the pregnant woman. This same argument was made during the Holocaust by rabbis such as Ephraim Oshry, imprisoned in the Kovno ghetto, who ruled that pregnancy was a direct threat to a woman's life, and so both contraception and abortion were permissible. Now we can move into the 20th century. Abortion was the most common form of birth control during the period under discussion. More effective methods, such as the oral contraceptive, were not yet available, and methods such as coitus interruptus required the cooperation and self-control of a male partner. So while abortion is not a contraceptive as we would think of it in preventing pregnancy, it does prevent the birth of a child. Despite how common it was, abortion was illegal throughout much of Europe during the first half of the 20th century. Poland criminalized abortion in its 1932 criminal code. criminal code suggests prison terms for both women who sought the abortions and those who performed the procedure. It is worth noting that nowhere in the 3 articles of the criminal code concerning abortion is it defined as either murder or killing in any way. The debates about abortion were happening publicly in Poland throughout the 1920s and 1930s, indicating that it was a topic very much on the mind of the citizens of Poland. Activist and doctor Tadeusz Zieleński, known as Boy, was a fierce advocate for sexual education, contraception, and the legalization of abortion, believing that illegal abortions posed a danger to women's lives. In his 1932 pamphlet, How to End Women's Hell, he cited the reasons he saw for women seeking to terminate their pregnancies. Foremost to him was poverty and the further burden that a child would bring to an already struggling family. In 1931, with the Jewish reformer and feminist critic Irina Krzywicka, he opened the first clinic for conscious motherhood in Poland, in Warsaw on Leszno Street. Run by Dr. Justyna Budzińska-Tylicka and Dr. Henryk Wyszynski, the clinic offered family planning services and consultations free of charge. Some estimates say that by 1932, the clinic had seen over 4,000 patients. I have not been able to confirm that, but I wouldn't doubt it given the popularity of these clinics elsewhere. Further discussion of the issue was found in the pages of the Jewish weekly periodical Eva, seen here, wherein authors advocated for the legalization of the procedure. Historian Eva Plach cites 40 issues of Eva throughout its short 5-year publication, where it discusses reproductive healthcare, abortion, and conscious motherhood. When Eva ceased publication, the issue was taken up in Nasz Przegląd, our review, which previously expressed support for Eva's progressive stance on abortion. The Conscious Motherhood Clinic opened by Zieleński and Krzywicka, and the discussions around abortion in the pages of Jewish periodicals such as Eva and Nasz Przegląd are proof of the widespread knowledge of the procedure throughout Poland. I would argue that the criminalization of it is also proof of the knowledge of it. Why criminalize something if people don't know about it happening? So this knowledge carried into the period after the German invasion of Poland in September of 1939 and the subsequent occupation and the ghettoization of Poland's Jews. Healthcare, including maternal healthcare, were vital issues for Polish Jews under occupation. As stated earlier, Polish Jews in the general government, which is the area under occupation, were rationed at approximately 184 calories per day. That is not enough to sustain anyone's health, let alone the health of a pregnant woman. Early on in the publication of Gazeta Żydowska, the official newspaper of ghettos and sanctioned and censored by German authorities, ads for obstetrician and midwifery services in Warsaw appeared. There were sometimes issues when ads for their services outnumbered the ads for other medical specializations. I think the only rival is dentistry in the ads that I've seen. Indeed, obstetricians and midwives were plentiful in the Warsaw Ghetto. The registration files with German authorities includes over 300 midwives and obstetricians of Jewish origin. This does not account for those who remained unregistered for whatever reasons they might have had. Ads for midwives often did not include names. You can see it here in this one on the right that says akuszerka. Instead, they list usually an address and some services that they might offer. Ads for doctors contained more information, often names and sometimes hours of operation and phone numbers for those who had them because the Germans left the phones operating for some people. Sometimes a change of address was provided for practitioners who had had to move from their previous offices into offices that were within the ghetto's borders. This shows a demand for medical care for conditions that happened throughout the normal course of life, in this case, pregnancy. Because abortion was illegal, services from abortion providers had to be spoken of in euphemisms. This was common practice not only in Poland, but elsewhere, such as in the United States and Germany, with ads offering to restore a woman's menstruation. In some of the ads, providers offered zastrzyki bezbolesna, which you can actually see right around here in this ad. That means painless injections. It is highly likely that this was an advertisement for abortion services, and the practitioner advertising this would have had to have trusted that potential patients would have understood that. My pages are sticking together. The presence of medical providers tells us that care was available for Jewish women. However, circumstances in the Warsaw Ghetto were so dire that medical services could not always be afforded. Tari Shulensky and Irina Kravitska recognized the economic hardship of pregnancy when they opened their conscious motherhood clinic, and those reasons remained during the occupation and ghettoization, albeit with much more extreme circumstances. Oyneg Shabbos, meaning a joyful Sabbath, was the clandestine archival operation in the Warsaw Ghetto founded by historian Emanuel Ringelblum. Their goal was to chronicle all aspects of life in the ghetto. Ringelblum wrote in his diary that, quote, "The historian of the future will have to devote a fitting chapter to the role of the Jewish woman during the war. It is thanks to the courage and endurance of our women that thousands of families have been able to endure these bitter times," end quote. His own archival group was doing much more than writing a chapter on Jewish women in the Warsaw Ghetto. They were actively chronicling the hardships that they were facing. Two surveys in particular show that concern for women and their health was paramount to these experiences. The work of the surveys about women is often credited to Cecilia Swapakova. One includes a set of questions about the kind of work women could find in the ghetto. It questioned if they were working as domestics, in factories, or even in the arts. This is important because to work was to be able to earn a wage, meager as it was, and to be able to purchase food, as little as was available. A job in the Warsaw Ghetto was never really enough to sustain a family, let alone another family member who might be born. The second survey is more directly concerned with health. It asked participants about their living conditions, including how clean their domicile was and whether or not they had something as simple as a towel. It asked questions pertinent to health, such as whether or not any of the women could take walks, how well they slept, their dental hygiene, their urination, and also the well-being of the children already living in the house. The survey also questioned women who were in the second half of their pregnancies. It asks about which clinic the woman in question might be attending and what her plans were after the birth. While this document assumed women would see their pregnancies to completion, it does show that care for pregnant women was a concern for the archivists with Oyneg Shabbos. Care for pregnant women was considered a part of the full history of life in the Warsaw Ghetto. What is evidenced by what I've just shared is that conditions in the Warsaw Ghetto were not conducive to a healthy pregnancy. Work was important, though not a guarantee. Disease was a part of daily life, and poverty was the norm. While all of these concerns were because of conditions imposed by the Germans, they do echo similar concerns that women had for terminating their pregnancies during the interwar period. We see this in tales like Rachel Frommer's and in others. Bella Fine, born Bella Kaplan, was from a small town called Morda, about 70 miles east of Warsaw. She later moved to Warsaw, where she met her husband, Arthur. Arthur was later deported, and Bella worked unloading military trains. Not long after he was deported, she discovered that she was pregnant. While she had a job, it was a physically strenuous one. Her husband was gone, and her family was in another town, and she had no idea if they were even alive still. She had no support system in Warsaw. Bella Fine chose to have an abortion and found a doctor who would perform the procedure. She knew she could not have a child in the conditions of which she was living. The literary critic, Marcel Reich-Ranitzky, recounted in his memoir that his wife Teofila, Tosha, had an abortion. Reich-Ranitzky worked as a translator for the Jewish Council and also as a music critic for Gazeta Żydowska. He married Tosha in 1942 after they both survived the Great Deportations. According to Reich-Ranitzky, they were able to pay for the procedure, but only after he sold the watch he inherited from his beloved grandfather. He and Tosha knew that they could not have a child at that time. He had, relatively speaking, a privileged position within the ghetto as an employee of the Jewish Council. Even that was not enough to ensure a safe environment to bring a child into. And having witnessed the deportations, he and Tosha knew that their lives were in danger. And this is a drawing that she herself did. It's part of a collection of drawings that she did, and her son preserved them. Adina Blady-Schweiger knew what medical options were available because she was a doctor. Under ghettoization, she worked at the Bersen and Bauman's Children's Hospital, and her position gave her firsthand experience with the particular hardships and cruelties experienced by Jewish children in the ghetto. While imprisoned in the ghetto, she married. However, she later lost her husband. After the final destruction of the Warsaw Ghetto in 1943, she went into hiding. She became involved with a man named Bernard. According to her, this relationship was for mutual companionship. When she became pregnant, she found a doctor who could perform an abortion, had the procedure, and told Bernard about it. She also later took other Jewish women in hiding to see this same doctor. This posed a risk to both her safety and those of the women she brought to have their own abortions. Finding a doctor who would not report them to the German authorities was a great challenge. Also challenging was finding funds to pay the doctor, not only for his services, but also for his secrecy. The alternative, though, was worth it for Blady-Schweiger and the women that she took to see this doctor. They weighed the options of having a child or gathering together the money to have an abortion and trust someone who could very well cost them their lives by informing on them. It should be noted, though, that the doctor also took great risk in seeing Jewish patients. I have focused primarily on Warsaw for the purposes of this lecture. However, this was a life-saving measure that occurred in ghettos throughout German-occupied Europe. We don't have the time to go more in depth and into some of the other examples, but I do want to briefly mention one more ghetto. Łódź was the second largest ghetto and lasted until August of 1944. The Łódź ghetto had approximately 200,000 Jews imprisoned there throughout its 4-year history. Rachel Herschenberg, a midwife, later recalled that a clinic specifically to perform abortions was opened in the Łódź ghetto, and that her job was primarily to assist in the procedure. The abortions were free of charge. The rest of this research examines abortion as a choice made to save lives. It's going to include not just Warsaw and Łódź, but also Wilna, Terezin, and Auschwitz. The purpose of this is to examine ways in which Jewish people, specifically women, were able to survive via a method that was only available to them as women. It is vital that we look at ways in which Jews were able to exercise their own autonomy, to stand up for themselves. Both Rachel Frommer and Bella Fine eventually remarried. They went on to have children and grandchildren. Marcel and Tosha Reichernitzky survived and had a son, Andrew. Adina Blady-Schweiger remarried and had 2 children, 4 grandchildren, and 2 great-grandchildren by the time of her death in 1993. Each of these women, sometimes with their partners, made a choice that they hoped would give them a better chance at survival. Because to have an abortion is to plan for a future. Thank you.
Thank you, Morgan. That was amazing. And it's just hard to know where to begin.
Yeah.
It's just such a tragic story, but we can start off, and I encourage people to put questions and comments in the chat in the meantime.
Yeah, and I'm happy to start with a question
Good.
to get the discussion going. Morgan, it's very powerful work. I think this question is probably sort of painfully obvious, but I'm wondering whether, or if you can speak to how the kind of current moment with all of the fraughtness around abortion as care versus, you know, the other image of abortion, and how there's a kind of cross-pollination historically between this moment, as you're arguing, of abortion as a survival mechanism and our contemporary moment.
Yeah, I think that, and again, I kind of alluded to this in the, I think, you know, when we talk about abortion now, it's a little bit inescapable that it's only talked about in Christian rhetoric. And I'm using the word rhetoric very pointedly here. And it's very much a new discussion. It's really not that old. It's only in the past 50 years, which I think as historians, we know 50 years really isn't that long. So that is still considered recent. And I know it is used. There's some politician, I think from Pennsylvania, who did a quote unquote Holocaust movie that was anti-abortion. And I can't remember the title, but that's okay because nobody should watch it. Where he tried to use the Holocaust as a way of expressing anti-abortion sentiment. And I think that if we look at it that way, it's to only assume that abortion is something tragic and not a medical procedure that is often life-saving and often necessary, and doesn't necessarily have to come with those connotations. There are certainly moments when, you know, women might feel very sad about the choice that they have to make. You know, none of the women who I've seen interviewed in some of these, Bella Fine and Rachel Frommer, have really expressed any sadness over what they chose. But also they both lost their first husbands, people who they loved. I don't think it's that much of a leap to assume that they would have liked to have had a child with that person eventually had their circumstances been different. And all of this is kind of a roundabout way of saying that, you know, the way we currently frame abortion and the way it's currently used is that it can only be a tragedy, and it's not. And I think that goes a little bit to what, you know, Patricia commented in the immediate aftermath of this talk, that it's tragic, and I actually don't find it all that tragic. It's you know, it is standing up for oneself. It's making a choice to survive. The women who are talking about this, and the, you know, in the case of Marcel Reich-Ranitzky, he's the one who wrote about it. There's not much of a sense of regret or sadness around it. They did what they did to survive, and then they later went on to live full lives. So I think part of what I'm trying to do here is to remove the tragic connotation to abortion, because it's simply not.
That's fascinating. I have to say I was very struck by the image you showed us of the skeleton of the baby in the red background. And that might have sort of led me to think of, I mean, she's describing her own experience, and it seems, so that one example made me think, you know.
And that's certainly tragic, but that's the tragedy of having to witness your child go through this. Not because the image of Teofilia Reich-Ranitzky, I think that's more, and I'll go ahead and I'll pull it back up, because it is a great image. And I mean, spoiler alert, I would really like that to be a book cover if I can get the rights to it. This to me is not the tragedy of having an abortion, it's the tragedy of seeing a child suffer. And so to choose to have an abortion is to choose to not make an innocent being suffer.
Interesting.
Yeah, I was reading it. I guess I was also reading it, I think the way Patricia was, as that's the child who is lost.
No, I think, you know, a lot of Tosha's drawings are not they're not about her. The title is Leben im Warschau Ghetto, so life in the Warsaw Ghetto. So it's everything that she's seeing around her. And I can imagine her seeing that and thinking, how can I bring a child into this? How can Marcel and I bring a life into this?
Interesting. There's a question in the chat. Morgan, thanks so much for your talk. I'd like to hear about how you approach the issue of agency in your research. How much space did these women have to make choices? How can this help us understand Jewish women's agency during the Holocaust more broadly? Great question.
Can you see the chat? Sorry.
Yeah, okay, thanks, Jules. Hi. Okay, so that is from Jules Riegel, who themselves is an expert on musical life in the Warsaw Ghetto. So look for their work at some point. So they shrug. So yeah, and I think agency is really important to what I'm doing here. I was actually recently asked at a conference what I thought my subjects thought of their own agency, and the shorter answer is that I don't think they thought of that. That's my interpretation of what they're doing. But often, you know, how often do we go through life and make a decision for ourselves and think, damn it, I'm showing my own agency, I'm expressing my own agency. We don't do that. But it is very important, especially because in what very, very little mentions we have of abortion during the Holocaust, it is treated as something that has been done to Jewish women rather than a decision that they have made for themselves. It's further harm inflicted on them. It's treated like another form of violence. And that takes away what they've done in making their choices of knowing that they have these medical options available to them. And I think that anyone who has been to the doctor now as a woman will tell you that agency is so damn important when you have to go and advocate for yourselves. So we can also look historically at that and see where that's happening. I fully admit that in this case, there is a bit of duress in making these decisions. It's a no-win situation, really. Like I said in my previous response, I think a lot of these women would have loved to have had children with the men that they chose to marry. I think they would have loved to have had a family, but with what few options were available to them, they knew what they needed to do. They knew where to go to get that. Like I said with Rachel Frommer, she went to her family's doctor and she got a referral. I mean, that's how we would look at it now, is going to a doctor and getting a referral to another doctor. And then the gynecologist performed the abortion. She knew the steps that she needed to take. And that takes that takes proactiveness to do.
Mhm. That's great. I have a quick question about if you have any sense of whether the malnutrition and the situations these women were under, I'm almost curious that they could get pregnant if there was so few calories a day. And so do you know any data about that?
I haven't found it yet. I kind of jokingly quoted Jurassic Park at one point, and I said, "Life finds a way." I mean, pregnancies are happening throughout the entire period of the Holocaust. If you look at the Holocaust and start it kind of at occupation to the end of the war, between 39 and 1945, pregnancies happening throughout the entire time. And it depends on where they're located. It's probably much easier for a woman in Hungary who is not going to fall under Nazi occupation or fall under some of the conditions that have been experienced elsewhere until 1944. It might be a little bit easier. There has been some work from others, or rather some inquiries that haven't really gone very far. I was actually going through Joan Ringelheim's papers in the archive last September, and she's actually got some really great medical files on menstruation and amenorrhea. And I think it was more like, I'm thinking of doing this as a topic, but I don't know where to go yet. So I'm going to start by consulting with medical professionals, which makes sense to me. That's actually the reason why I'm relatively sure that the painless injections were for abortion, is because I asked my cousin, who's an obstetrician, what could this possibly be? Which made for a great 4th of July conversation at the barbecue.
I have a question that follows on that, and then there's another question in the chat, but it seems to me, and I felt this also when you and I were talking in November, that this research is incredibly original. And I'm old enough to remember when there was quite a big brouhaha and debate within Holocaust studies over the suggestion, how dare they, that women and gender in general be considered as part of Holocaust studies, right? There was a quite sort of masculinist pushback against that, because the assumption was that it's a universal thing, and therefore, how could you introduce a category such as gender? So you mentioned Zoe Waxman. I don't know her work, but it seems like what you're doing is sort of the next step, right? Like gender now, however many 20, 30 years later, is now firmly part of Holocaust studies, thanks to trailblazing women like Sarah Horowitz and a whole group of other sort of women who made that a point. And it seems like you're going kind of the next step into a further sort of deepening of the category of gender. And I just wondered if you could speak to that a little.
So first of all, thank you. That's very nice to hear. we strive for originality, don't we? That's kind of what I mean. I think every grad student's worst nightmare is finding out someone has just published something that you've been trying to work on. So thank you. So the short answer to this is, if people were willing to talk about it, why shouldn't we ask questions about it? Rachel Frommer and Bella Fine both offered up the information about their abortions. Their interviewer did not ask them, did you get pregnant while you were in the ghetto? Did you have an abortion during the ghetto? Those questions weren't there. They offered them up. Bella Fine did preface it by saying, I don't know if I should say this, but also I would question, she was interviewed in the mid or early 90s. I would question if she's saying that because she doesn't know if she should talk about it, or if she's saying that given that she's in the 90s where we had a very different perception of abortion, even than we do now. Time moves so quickly. Yeah, it's worth asking, but also, it's universal, but it isn't. Yes, every single Jew suffered. We like to shout out the number 6 million of victims. It's 11 million victims. Every single person, even if they survived, was a victim of the Holocaust. And we have to look at their differences. I think it does a disservice to treat it as there's, this universality that every experience was the same, and we shouldn't differentiate to it, because that means we're treating one as a default, and that's not the case. So why should we treat something as a default when it means that we ignore half of the population and what they did? And I'm obviously I'm making the distinction because pregnancy is a biological occurrence in women. And I will say that with an asterisk, because there are women who obviously cannot have children. It's a messy, not messy, it's a more complicated conversation than we have time for right now. But I've also involved men in this. I mean, I talk about how Rachel Frommer's husband was waiting in the hallway for her. The one who talks about Tosha's abortion is Marcel Reich-Ranitzky. Now, granted, he does seem to be more affected by the loss of the watch than he does about the abortion. He spends a lot more time talking about his grandfather's watch. But I'm not ignoring any gender or any sex here. But we have to look at the differences, because otherwise it seems so grossly unfair to people who were doing everything they could just to make it through and to get out of this.
Yeah, good. We have a couple questions in the chat, one from Raul. Can you say more about the provenance of the term standing up for oneself? In what other situations besides seeking an abortion would it be used?
Oh, I would extend it to any form of medical care here during the Holocaust, just in terms of being able to find a doctor, being able to pay for a doctor, whether it's sneaking in medication. Warsaw, of course, has a notorious black market that's not just about food, but about other materials as well. This is a really good question. Rolo is one of my other advisors, so I should probably think about this a little bit more. Certainly something to add. Like I said in the text of the talk, I'm really hesitant to use resistance because it gets so overused. And if everything is resistance, then nothing is resistance. It kind of runs itself around. So I think even certain cases of, I would even say familial norms of putting together dinner for your family and trying to maintain those habits that you have when humanity is trying to be stripped of you is a case of actually standing up for yourself. In this case, I just think it fits so much more than resistance does, because it is so inward, and it doesn't have a target. And I think that's kind of the issue with me, and kind of my reluctance to refer to this as resistance. I know a couple of other historians have actually said that it is. There's a really great article on biological practices in the Łódź ghetto that does argue that abortion is resistance. I just don't agree.
And in a way, that phrase "standing up for oneself," it's quite literal in that you're choosing your life over the life of a baby, right? So you're, for oneself, it's caring about your own survival first, which you still have to do on a plane when the oxygen mask comes down, right? It's still,
Right, yeah.
yeah. There are quite a few more questions. One from Zora is long, and it says at the end you don't have to answer all, but the point is that many of the women you talk about are married women, and does this impact their choices, even in terms of talking about their abortion after the war? So does marriage make a difference? And then also the demographic profile of these women, were they mostly upper and middle class, well educated? Does that mean it's more of an urban phenomenon? Is it different in, say, the more rural areas? And feel free not to answer all of this.
That's okay. If I forget anything, she knows where to find me.
Okay.
I'm going to scroll and read.
Yeah, sure.
Yeah, so they are married. I don't know if their marriage really affects it, because I think the assumption would be if they're married, there is some sort of a support system to do this with somebody else. The burden is not simply on yourself. So I haven't actually found that many differences. The majority of what I'm finding for women having abortions is that they're in committed relationships. Whether they're married or not, these pregnancies are the result of someone who, at the very least, they like a lot. I think as in the case of Adina Blady-Schweiger and Bernard, who, she was mourning her husband who she had lost, and found mutual companionship. They both did. But yeah, and I think, that's something that has come as a surprise to a few people who I've talked about. I think that also going along with the tragedy aspect, there was a lot of assumption that these pregnancies were the result of rape, and that hasn't been the case. So I don't know how much the marriage aspect is factoring into them having the abortion. There's also not that much difference of how women are talking about it when they're not attached to someone, as opposed to when they are, other than the fact that on occasion a partner will attend the abortion with them, as in the case of Rachel and her husband Ephraim. I think the middle class question is interesting, and the well-educated class is interesting. Rachel Frommer obviously was training as a nurse, as I mentioned. Adina Blady-Schweiger was a doctor. So that obviously gives them some insight into medical procedures. Documentation for the less educated and the classes of people who have less is usually a little bit less. So I haven't actually found that much of a difference. It is something that I'm asking and that I'm very much concerned with. But also some of the documentation that I have, it doesn't say what their economic standing was. And I think that's also part of the universality of the Holocaust, is the assumption that everybody was poor, which is true, but also some were a little bit less poor than some of the others there. So I think that that's coming in, and I am looking at this as an urban phenomenon because I think that that is a structure that works for this, because, ghettos are, the ones I'm talking about are in cities. They have a structure that is very similar to cities that existed before ghettoization was imposed on these places. But that doesn't mean that every resident there is actually from the city. People from rural areas were deported into these ghettos, including in Warsaw. So the class distinction is there when I can find it, but it is also not always mentioned. So.
There's another question in the chat from Xiangzhan Choi. If I understand correctly, that you mentioned that you're using abortion and reproductive health care interchangeably. Could you explain the specific reasons behind this choice? What might be the implications of using these two terms interchangeably?
So I'm very aware that my topic is political, and it exists in a very politically charged environment surrounding the topic of abortion. And I firmly, I don't believe that a scholar can divorce themselves from their work. We're not apolitical beings. We're simply not. And what we believe and what we strive for is in our work. So you are getting my politics in my work. That doesn't mean, of course, that I am manipulating my sources to fit my politics. I'm certainly not. That's dishonest, and nobody should ever give me money to do this ever again if that's the case. Abortion is reproductive health care. That's kind of the simple answer to that. Doctors are trained in this procedure not because of the assumption that women want to end their pregnancies and will just, wake up and decide this isn't right for me, I don't want it. To clarify, I don't think there's anything wrong with that. Doctors are taught this procedure because it is a medical procedure, and because oftentimes it is a life-saving medical procedure. A D&C is a common thing to be taught in medical school. So the reason I use them, it is intentional, and that's because, like I said, abortion is reproductive health care.
That's great. I want to jump in very briefly before the question from Jamie, and that is, there must have been other abortifactants available, right? So I know you're talking specifically about surgical or abortion by injection, but there must have been sort of folk remedies as well.
Yeah. And I'm still actually going through and trying to find them in some of the sources. This is historically been one of the reasons why abortion's been a difficult crime, quote unquote crime, to prosecute, at least in earlier centuries, is because there's certain things that you can't trace, especially if there's no evidence of anything having been there to begin with in order to have, expelled it, we'll say. And I'll use that intentionally because the Polish verb in the penal code means to spend, to get rid of. And I absolutely just lost my train of thought. I'm sorry.
I was just coming at it from, since I'm a classicist, women knew very well, in
Oh,
the
yeah, of course. Yeah. And those are still being used. I've actually come out of this project with a newfound appreciation for midwives, especially when, formal obstetrics as we know it is really new in the point that I'm talking about. It's relatively new to the 20th century. Even, the entire culture around pregnancy is a post-war phenomenon coming out. But midwives in particular, and I think this is also, kind of goes to Zora's question of class, what kind of care you could get is based on what you could afford. And if you can't afford a full-on medical procedure in a clinic, then, there are other options, such as, I think Laurel was an abortifacient at one point. So those are there, and I'm certainly looking for more of them. But again, I'm not finding that much documentation from those of lesser means. But yeah, it's certainly there, and it's actually part of a syllabus that I've kind of been tweaking about a global history of birth control and abortion.
And that's perfect because it goes right into the last question, which is, thank you for your talk, from Jamie. Have you had a chance to use any of your research yet with students? If so, how did you approach it with undergrads? If you haven't yet, how would you like to introduce it? So you just mentioned your syllabus.
Yes, which I will hopefully someday get to teach. I named it after a pregnancy test I found in a vending machine in Berlin called Maybe Baby. You can find so many things in vending machines in Berlin. So, and Jamie knows because she was a TA, we don't always get to teach our topic. And the last time I taught the Holocaust course, I wasn't that very far in my research yet. I get a lot of students who actually come up to me, even if I'm TAing something like baseball and American history, when they find out what I do, they want to sit down and they want to talk more, which is really encouraging. I've had students email me like 2 semesters after I taught them, asking me, what else is going on, or if I can help them with another project. I run toward it, actually. I have no problem. One of the, I used to be asked, well, would you ever want to teach high school? And the answer is no, because I couldn't do this. I couldn't really, approach them and talk about abortion and, anything to do with sex or medical history the way I'm doing, which is why I want to teach at a university. So approaching it with undergrads, bluntly, my students always know that I'm pretty blunt and very, very forward when talking about these things.
That's good to hear. That's great. Any other questions? And if not, I'm going to put a slide up at the very end if you want to stay on for a bit about our future events. You can also find them on our website. But let's thank Morgan one more time for a really fascinating talk. Thank you so much.